Hi, my name is Amber Stanley, and today we'll be discussing the recent outbreak of cholera in Tanzania. Cholera is a bacterial infection that causes infection to the intestine, resulting in acute and severe diarrhea. The main symptoms of cholera include diarrhea, vomiting, leg cramps, shock, and death. Cholera is caused by a bacterial pathogen, Vibrio cholera, and is most commonly transmitted through contaminated water, although it may also be contaminated through shellfish as well. Cholera may affect anybody of any age, age, or gender and is less common in developed countries. The most recent outbreak is in Tanzania, Africa, the orange region you see highlighted in the map to the right. Cholera has posed a public health problem for Tanzania since 2015, affecting nearly 26 regions overall. Between 2015 and 2018, more than 33,000 cases have occurred, resulting in over 500 deaths. In 2017 alone, there were nearly 5,000 cases with almost 100 deaths. The chart that you see here shows that over time, the general rate of cholera has decreased. However, in the year 2018, we have seen new cases occur in regions that have not previously experienced cholera. Those regions can be seen here in this map. In the first 18 days of the new year, there have been 127 new cases that have resulted in 4 deaths already. The regions that you see were not previously affected, thus, controlling and investigating this outbreak is critical. To do so, the following steps should be taken. The first step is to prepare for the investigation. This includes identifying team members, such as healthcare professionals, scientists, and laboratories. The next step is to confirm that an outbreak has occurred through verifying diagnoses. This step includes asking questions such as, how does this disease compare to other geographical regions? Is it common and is it serious? Next is to identify and count cases. This includes posing questions about exposure, time, and symptoms. Since cholera is known to come from contaminated water source, that narrows down our investigation somewhat. We can ask individuals where they obtained drinking water and what water they came into contact with. In addition, since cholera is a well-established disease, the case definition can be specific, highlighting the most common symptoms that I noted earlier. To identify cases, surveying health clinics, hospitals, and exposed people will be done. The following step is to select a case study design. For this outbreak, I will use a case control study since the disease is affecting the entire community and the immediate source of exposure is not yet known. Next, I'll gather information about the infected population, such as where they were, when they were there, and if others were with them, and if those other individuals have the same symptoms. To do this, a questionnaire will be distributed. This can easily and quickly be done and gather information for public health professionals so they can take action fast. Next is to organize the data. This will be done using a spreadsheet, preferably on a computer to increase efficiency. The sheet will organize data such as patient demographics, symptoms, onset of symptoms, and will allow for a quick summary of those critical factors. The next step will be finding the location of the infection site and stopping the cholera by containing the site and continuing to treat those individuals. In an effort to reduce transmission and prevent future outbreaks, increasing community education is important. According to the Center for Disease Control, the following steps should be taken to prevent cholera from occurring, including drinking treated water and frequently washing hands. Thank you for your time.